A wave of pneumonia cases is sweeping across China and is hitting children particularly hard. Given the parallels with COVID-19's emergence, it's fueling concern, but is that warranted? Chinese officials say that the recent uptick in the number of people getting sick is because of known germs, and that no new pathogens have been found. Among some of these known germs are Mycoplasma pneumoniae, which is a bacteria that local media say is behind an increase in infections among some young children here. Mycoplasma tends to cause only mild colds among older kids and adults with robust immune systems, but younger children are prone to developing pneumonia. Most people will recover on their own or with over-the-counter medication, but severe illness will require a course of antibiotics, but the bacteria is also resistant to some drugs.
Some initial reports suggest that hospitals in the world's second largest economy are inundated with child patients. Most of them suffer from what is being termed as pneumonia. Mycoplasma pneumoniae is also referred to as walking pneumonia. Walking pneumonia is a type of lung infection that can be life-threatening for some people. This has prompted the World Health Organization to seek more details. WHO said Chinese authorities from the National Health Commission held a press conference on November 12 and reported an increase in respiratory diseases in the country. It is a part of International Society for Infectious Disease. It called for more information about the undiagnosed pneumonia, China, Beijing, Liaoning. The standard wording of the alert was very similar to the first ever noticed about what would become as COVID-19.
China's Health Commission has blamed a combination of pathogens, including influenza, for a surge in acute respiratory infections. The country has seen a spat of outbreaks of respiratory diseases that have hit children particularly hard. Chinese authorities have told the World Health Organization while there have been increases in hospitalizations, the sources of the illnesses are all known germs.
肺炎的患者需要住院治疗，始终是满房状态。
为了让大家得到及时的救，
家长依然很多。
目前就是正处于我们
要努力增开相关诊室和治疗区域，适当延长服务时间，加强药品供应保障，发挥中医中药作用，最大限度提高接诊能力和诊疗规范化水平。
呼吸道感染的高发期，包括肺炎支原体院的呼吸道感染的那个占比，大概在我们全部门诊量的40%左右。
监测显示，近期呼吸道感染性疾病以流感为主，此外还有鼻病毒、肺炎支原体、呼吸道合胞病毒、腺病毒等引起。分析认为，近期我国急性呼吸道疾病持续上升，与多种呼吸道病原体叠加有关。今天的发布会，几位嘉宾介绍了冬季。
Hospitals in Beijing flooded with parents and kids awaiting checkups, as China sees clusters of pneumonia spreading in the north of the country, affecting mostly children.
We begin with the outbreak in China. It's too big to ignore. They're clocking more than 10,000 cases a day. Most of the patients are children. They're coming down with a mysterious pneumonia. They have infected lungs and fever, but the cause of the illness is still unclear. We don't know exactly what this disease is, and China won't say how many cases there are or how widespread the outbreak is. Unofficially, it's being called a walking pneumonia. Officially, China is not sure what it's dealing with. But here's what we've been able to piece together. It's massive, with thousands of patients, mostly children. There is anecdotal evidence from key hotspots like China's capital, Beijing. The Beijing Children's Hospital is overwhelmed. They're getting 7,000 patients a day. That's the daily average, 7,000 patients. Another hotspot is Tianjin. It's a metropolis in northern China, close to Beijing. Last Saturday, Tianjin reported a big surge, over 13,000 cases in 24 hours. And this is just from one hospital, the Tianjin Children's Hospital. The biggest one in the city, this hospital. And remember what the pandemic taught us. These numbers are only a conservative estimate. They do not reflect the full scale of the crisis. If 13,000 patients end up in hospital, there are most likely many more outside, many more carrying the infection. That's the first point to note. The second is this: the outbreak is not recent. It must have begun weeks ago for the numbers to swell like this. And it appears that thousands of patients in multiple cities are now infected in China. These are parents standing in long queues, waiting to get their children treated. There is also a grab of a hospital screen. It says there are more than 700 patients in the queue, 700 patients in the queue. And what's the waiting time to see a doctor? More than 13 hours. Then we have this picture, again from a hospital in China. These children are sick. They have been placed on an IV drip, but they're still doing their schoolwork. This looks like a classroom inside a hospital. All of it is quite alarming. But guess what Beijing says? It's not unusual. They released a statement to this effect today. It said that they've not found anything unusual. They found no novel pathogens, meaning no new virus or bacteria. China is basically saying this is not a new disease. And this is what they've told the WHO, the World Health Organization. But what is causing the surge then? Why are so many children falling sick in China? According to Chinese reports, they're dealing with a perfect storm, a nasty flu season, where multiple diseases are circulating like influenza and Mycoplasma pneumoniae. It is a bacterial infection. So this is China's assurance. But remember, the same China had misled the world in 2019. In a similar fashion, it had played down the Wuhan virus outbreak. When the virus was spreading rapidly, China insisted there was no human-to-human transmission. They lied to the world, and the WHO took their word for it. It was a mistake that cost the world millions of lives. This time, China has shared some data with the WHO, but some experts say it's not good enough.
The reports reference swamped pediatric hospitals in multiple locations, including Beijing and Liaoning, which is around 800 kilometers away. Reports also say that pneumonia outbreaks have led to school cancellations and some illnesses amongst the teachers. Some observers speculate the outbreak could be caused by Mycoplasma pneumonia, commonly known as walking pneumonia. Mycoplasma pneumonia mostly causes a chest cold. Symptoms include sore throat, fatigue, and a slowly worsening cough that can last for weeks or even months. The prolonged illness and the risk of pneumonia is what's alarming parents at the moment in China. They also cited circulation of known pathogens, including influenza and common bacterial infections known to affect children. On November 21st, Media and Public Disease Surveillance System ProMed reported clusters of undiagnosed pneumonia in children in northern China. The WHO said that it was unclear if these reports were related to the infections discussed at the authorities' press meeting and that it was seeking clarification at the moment.